My name is Gwen Regan. I am the HSE National Director of Nursing for Infection Prevention and Control with Community Operations. I undertook a postgraduate diploma in infection prevention and control in the RCSI School of Nursing back in 2011, and I have worked for many years in community infection prevention and control. When I was a teenager, I was involved with the Order of Malta Ambulance Corps, and I got a real interest in treating people at the time. When I was about 17, I got a job in a local nursing home. And I loved looking after the older people there. I didn't know any nurses. I had no nurses in my family, so I didn't really have a clue, to be honest, what the job entailed. But I just felt it was in me to be a nurse, and that's what I went for. So I undertook my undergraduate training in Beaumont Hospital School of Nursing. In the early 90s, we didn't do degrees in nursing. We did apprenticeship style model of nursing. So we trained over 3 years. And when I finished my nursing training in Beaumont, I loved neurosurgery and I went to work in London for a couple of years. When I came back to Dublin, then I wanted to change from neurosurgery. So I went to work in St. James's Hospital. But at the time, I suppose towards the end of the 90s, I decided I'd like to try something completely different. And I went to work for a pharmaceutical company. As a clinical assurance auditor for phase 4 clinical trials, I used to do an awful lot of travelling around Europe. However, when my children were born, my public health nurse recommended, because I was so upset about all the travelling I was doing, she recommended that I should go back to nursing, which I did. And I started in the community 20 years ago. I absolutely love the community. I'll never leave it. And through my development in the community, I worked as a community nurse initially, but then an opportunity came up to get into infection prevention and control. And part of the contract was to complete a postgraduate diploma in infection control. So I was very lucky to be supported by the HSE and my Director of Public Health Nursing to go to the RCSI and complete that postgraduate diploma. So the RCSI programme was very acute focused, and it was being, up to that point, it was delivered predominantly by people who worked in acute services. I mean, it was fantastic. We had access to microbiologists, infectious disease consultants, infection control nurses working in the acute sector. But there were very, very few of us in the community setting. So we really kind of fought to have our voice heard within the infection control world. And I remember meeting colleagues on the programme and saying, this doesn't work in an intellectual disability setting. You know, this doesn't work in mental health. So with the result that actually the course coordinator asked would I come back every year, and I did it for a few years, to give an overview of community and how it works and how things are applied. Community, it's really all about the service user. We start there and we work our way out to see how can we apply precautions to protect the service user and protect staff. So it's not black and white, it's very grey. We have to work with services, we have to work with service users to find the right fit for them, because we know some infection control practices can cause harm, such as isolating patients. COVID-19 has been incredibly challenging. Everybody working in health and social care and frontline services at this stage has had 2 years of relentless COVID-19, and it has been a huge learning curve for us all. You know, I do remember the early days, and I remember being calm with staff and trying to be pragmatic and sensible when I was dealing with all our staff, but going home myself terrified and worried that I might die because I'd just been in an outbreak, you know, and who'd look after my children and all the other things. So behind everybody who was involved in leading and making decisions during COVID-19, there was a real life behind all of those people, and we all felt it. So to be delivering kind of education and learning and training to staff and to service users when you have very little evidence to base it on is incredibly challenging, and worked together. I've never experienced teamwork like it. I've never experienced a positive work environment like it to get things done and just do what we were being asked to do. And I think if we don't learn from all of this, what is the point? We will have more pandemics. And I hope we all, remember very quickly that when everyone comes together, you can have action. And thank God vaccination has been a life changer for everybody. So when I found out I was nominated for this award, I was actually in my kitchen. I was working from home, and Professor Zena Moore rang me. And when I saw her name on the phone, I hadn't spoken to her in a long time, and I assumed it was something to do with wound care and infectious microorganisms in wounds when I answered. So I was actually completely speechless when I got the phone call from her. I was really delighted. I'm very humbled because I'm just one person in a huge system, and the system deserves this award. All my colleagues in infection control, I have incredible nurses working with me in infection control across the country, assistant directors in nursing, clinical nurse managers and clinical nurse specialists, and they are day to day delivering fantastic care and support services, keeping things going. So Yeah, I'm really surprised. I'm really shocked, and I'm very proud of it, and I'm very honoured and very humbled to receive this award.